Hi, I'm Dr. Stephanie Saucier, a cardiologist. I'm seeing more patients diagnosed with cardiac amyloidosis recently. And so I've created this video to help patients understand what cardiac amyloidosis is, what tests may be done to help diagnose this, and how are we currently starting to treat cardiac amyloidosis. Let's dive in. Cardiac amyloidosis is a restrictive cardiomyopathy where extracellular myocardial proteins deposit into the heart muscle itself. Most commonly, the monoclonal immunoglobulin light chains, are deposited, or transthyretin amyloidosis, or ATTR. So light chains or ATTR, cardiac amyloidosis, are the two types that we talk about when we're talking about cardiac amyloidosis. ATTR can be caused by pathogenic variants in the transthyretin gene. Some of the common symptoms of cardiac amyloidosis include irregular heart rhythms, shortness of breath, swelling of the lower extremities, or fatigue. Amyloidosis is a restrictive cardiomyopathy. Basically, what happens is proteins that are irregular misfold and end up in the muscle of the heart. And this causes the heart to not be able to relax as well as it should. Interestingly, you can see ATTR or TTR cardiac amyloidosis if you have severe aortic stenosis, bilateral carpal tunnel, biceps tendon rupture, or even neuropathies or spinal stenosis. These are some other conditions that might be, in an indirect way, related to cardiac amyloidosis. So it's important, if you have these things, maybe to think about whether or not you're at risk for developing cardiac amyloidosis. Cardiac amyloid is still underdiagnosed from what we understand. How do we diagnose cardiac amyloidosis? Well, first it starts with thinking that you have it. A lot of times we'll see thickening of the muscle on your echocardiogram, which is an ultrasound of the heart. And we also can see changes on your EKG where we see irregular heart rhythms. From there, you may also get blood work to rule out AL amyloid, looking at the proteins in the blood and looking at the kidney function. We also will sometimes do something called a PYP scan or an HDP scan. And that's basically just a fancy test where we look at the heart itself, we give you a special medication, and we see if the heart muscle is being infiltrated with that irregular protein. Sometimes we also need to do biopsies, but it all depends on, are we able to get the diagnosis without biopsies? If not, we might need to biopsy as well. So we typically start with the less invasive tests: blood work, EKG, echocardiograms. How do we manage cardiac amyloidosis? Well, it really depends on a lot of factors. It depends on what type of amyloidosis you have, whether AL or ATTR. It depends on how much of the muscle is affected and whether or not you have heart failure also with the amyloid. And so there's different medications that we can use, and there's different things that will slow the progression of the buildup of the amyloid particles and also slow the progression of the heart failure or the restrictive cardiomyopathy. So there are treatment options out there now, which wasn't always the case, but it's really important that you actually seek care from an amyloid specialist team or a center that specializes in cardiac amyloidosis, because they're going to have the latest and the greatest treatment options for cardiac amyloid. Sometimes if cardiac amyloid gets too severe, patients need transplants or other advanced therapies, but it really depends on what type of amyloid you have and how severe it is. If you found this video interesting about cardiac amyloidosis, please like and follow for more. You can also see below the link to our heart health guide and additional information on cardiac amyloidosis. So we'll see you next time, and like and follow for more.